Well, good morning, everyone. Thanks for joining us for another media Q&A. Today we have Dr. Suzanne Judd. She's a professor with UAB School of Public Health. Today she will be discussing data that reinforces the safety and efficacy of COVID vaccines. We will be providing a recording of this shortly after we conclude. If you have questions, please drop them in the chat or raise your hand using the Zoom function. I believe Dr. Judd doesn't have any opening statements, so we are going to begin with some pre-submitted questions from WBRC. So Dr. Judd, will we ever reach herd immunity with the low vaccination rate in the US and in Alabama? If not, what's next?
So that's a great question. The answer is probably not. It's doubtful that we'll reach herd immunity since we don't have a lot of folks pursuing vaccine. We really needed about 70% of the population to get vaccinated in order to get to herd immunity. So when you think about herd immunity, I like to think about it in a couple of different ways. Imagine a pipe with water in it. That pipe with water is what we have with no immunity in the population. The water just flows through the pipe and gets to the other side rapidly, which is like the cases, they spread really rapidly. Where we are in Alabama right now, I think about like honey. It's honey in the pipe. It's slowly moving through the pipe and the cases are building, but they're not building at super high rates. Herd immunity would be like concrete, liquid, semi-liquid concrete in the pipe. It's flowing, but it pretty much is going to come to a stop at the end. And we really aren't getting to levels where we're going to stop the cases to get to that non-movement of cases. So what's next? What's next is what we're seeing right now with low case numbers, less than 5 per 100,000. If you're looking at the ADPH tracker, that means less than about 2,800 cases on a 14-day average, which is where we are right now. The one place we're not is hospitalizations. I'd also like to see that at less than 200 to indicate that we were at decent levels of immunity to keep the cases down. That could change in the future as folks that had immunity from the infection, as that starts to wane. We know that about 30% of Alabamans have had some level of infection from COVID and have antibodies against it because CDC is regularly testing that. That 30% is providing a little bit of a buffer in addition to the vaccine to keep the virus from moving through the population. But the folks that have antibodies from the infection, we know those antibodies may fade eventually. So we really need folks to continue getting vaccinated so that we are in the fall sitting right where we are right now with less than 2,800 cases every 1,400 days. That's a manageable level for the hospital system, for the healthcare system, but it's not herd immunity.
Right. Thanks, Dr. Judd. Our next question is, what will the new normal look like once we do reach a point where COVID is a lot more manageable?
The new normal looks very similar to what we're seeing right now. You'll see some people still wearing masks as they don't feel well or they don't want to be in public without a mask on. You'll see cases continue to accumulate. You may see isolated outbreaks, particularly in communities that are not heavily vaccinated. There may be certain counties or certain cities, certain social organizations that are not choosing to get vaccinated. And if you've got a population of people not wanting to get vaccinated, you might see an outbreak in that group. So those are the things that we'll continue to watch. It'll be very similar to what happens with influenza as we watch and it moves through different periods of high level of case transmission to low level of case transmission, but it doesn't go away. We're still stuck with it. The difference between COVID and influenza is it's a much more dangerous virus. You're more likely to wind up in the hospital with COVID. It's more likely to cause death than influenza. So again, this is one that you would much rather get vaccinated for rather than have to deal with the infection.
All right, we now have a question from Alan with WBRC. How serious is vaccine hesitancy in Alabama? Could UAB be facing discarding Pfizer vaccine in the coming months due to low demand?
That's a great question, Alan. It's serious. Vaccine hesitancy is very serious right now in Alabama. We really have reached a point that folks are just trickling in to get vaccines. We do know how to store the vaccine and keep it safe, so it's unlikely we would have to discard doses. Those procedures are very well established, and UAB is great at managing their vaccine. But you're exactly right. Basically, Pfizer, Moderna, AstraZeneca, Johnson & Johnson, any of the vaccine makers, if there's not demand in Alabama from either UAB or pharmacies or grocery stores or any place administering vaccines, if there's no demand, they're not going to send supply. So now imagine you're one of those people who hasn't been vaccinated and all of a sudden a new variant comes on the market and it starts spreading through the population. Those vaccines may have been reallocated to other countries or other states and may not be available when you need it most. Right now, we have vaccine and we have ample supply. It's a great time to get vaccinated. But no, it's not likely that those vaccine doses will go bad.
All right, so speaking of variants, we have a question from Chip with WBTM. How concerning is the new California variant, and do the vaccines protect against it?
Chip, that's a great question. Every time a new variant comes on, it takes us a little while to know how successful the vaccines are at protecting from the variants. So far, all of the variants have been shown to, the vaccines offer some level of protection. Even the Delta variant that people are talking about that came from India and is circulating in the UK currently, with some cases here in the United States as well, we do see that the vaccine provides some level of protection. And honestly, even if it were as low as 50%, which in most cases it's more like 80%, 50% is great. It gets us back to that analogy I made earlier. It's not water, it's more like honey, not quite up to concrete yet, but it really is not flowing as fast as it could if you've got some vaccine-based immunity.
Okay, we have some more questions from Alan. What is the latest information about how effective the vaccines are? Will that make a difference in those who are on the fence or are opposed?
We have decades of public health history where we know what makes a difference for people. I'm not sure that the people on the fence are going to feel better if they know that the vaccine is effective. I think that for the most part, they know that the vaccine is effective. We have to tap into a slightly different motivator for those folks. For those of you that are wondering, that are sitting on the fence if the vaccine is effective, it absolutely is. Here in Alabama, the groups that are pursuing vaccination at the highest rate are people over the age of 65. And hospitalizations in those groups have plummeted. Right now in Alabama, it's the 30 and 40 and 50-year-olds that are most commonly in the hospital. Interestingly, the 20-year-olds are pursuing vaccination at higher rates than those groups as well. So we're starting to see hospitalizations come down in 20-year-olds. Why that is, maybe it's because they lost something that they really wanted socially in their 20s, and so they see the vaccine as a return to normal. It's tough to say why they're willing to pursue vaccination more than, say, the 30 and 40-year-olds. But for those of you that are sitting on the fence, we are seeing hospitalizations in 30, 40, and 50-year-olds in Alabama, and those are the lowest vaccinated groups. So this vaccine works, it's safe. If you're thinking about sitting on the fence, jump off, give it a try. We've got millions of people that have been vaccinated with very few side effects. And again, the most important thing is this pandemic could turn again in the fall, and you want to be on the side of being vaccinated if that virus starts circulating rapidly again.
Okay, and do you expect an increase in positive cases over the next few weeks due to Memorial Day activities?
I was watching that. I actually expected if we saw a surge, we'd see it by today. June 10th was the day that I was waiting for to see what was going on. It looks like cases are going down. So it looks like we may not see a surge from Memorial Day. Again, I think we've got this boost in Alabama because there is some level of immunity from people that had the virus, but may not have had a severe infection. That will go away eventually. So when we hit Labor Day, that same benefit may not be there if those people don't get vaccinated.
Okay, and this is from Chip. What advice do you have for people who are fully vaccinated? How should they behave in public? Should they still take precautionary measures?
That's a great question. CDC has indicated that in public that masks are not needed for fully vaccinated people, with a few caveats. So large gatherings like sports and concerts where people might be yelling or singing or being more active, it's probably still a good idea to wear your mask there. When you're in public in the grocery store or just out and about, it's not required. Now, whether or not you're comfortable with that is totally up to you. If the mask has given you personally some level of comfort and you want to keep your mask on, you should feel free to keep your mask on. That you don't have to, the vaccine protects you, but it's certainly reasonable to continue wearing a mask if that makes you feel safer.
Okay, Alabama ranks next to last in the nation for vaccine uptake. How frustrating is this to you as you work to encourage vaccinations?
It's always frustrating. Usually we're in a race to the bottom with Mississippi for lots of public health challenges, you know, getting people to stop smoking, healthy diets, things like that. Alabama is one of those states where we have to work a little bit harder to talk to folks. But that said, it's just an opportunity. I look forward to it. I love talking to people about vaccination, about eating healthy, lots of the things that we do in public health to try to change behaviors. But this is common in Alabama. There's a general hesitancy here to follow public health guidelines and recommendations. People want to think about it a little bit longer. They want to process it, make sure that they believe it's safe for them and their family. But again, I welcome those dialogues. They're great to have. It's important that we all talk to each other so people do feel comfortable practicing safe public health measures like getting vaccinated.
Okay, this is from Alan. We keep hearing that we should expect to see increase in positive cases and hospitalizations in the fall. Why is this?
Because of the seasonality of influenza. So we're basing a lot of what we expect for the fall on what we know from influenza. As people start to move indoors again and they're not spending as much time outdoors, you do typically see a rise in influenza cases and other respiratory, common cold, other virus and bacterial infections. So it's because of the cyclic nature that we know from other viruses and bacterias, we expect COVID to behave the same way. We don't know that it will for sure, but that is what we expect. Here in Alabama, what we've observed, we saw big increases last summer. Even though the case counts don't represent it, we weren't doing as much testing in the summer. We saw lots of hospitalizations and deaths in the summer last year due to COVID. Then we saw a slight downtick, and then it soared back up again in November, December as the holidays came around. So that may be more what our pattern is. It may be closer to November or December before we see the uptick. It's warmer in Alabama through the fall, so people don't tend to go inside as quickly as they would in northern states. But we definitely know that there will be some type of seasonal variation. Again, if we have high levels of immunity, that will be a fairly small uptick, very manageable by the hospitals. If we stay down at 30% vaccinated like we are right now, it could mean to much higher levels of cases that we would see in the fall. So it really depends on several factors, but that's why we expect seasonality.
Okay, and can you reiterate which populations most cases are occurring in right now?
Unvaccinated. The bulk of cases are occurring in unvaccinated individuals. By age, it's really that 30 to 40-year-old age demographic that's experiencing the biggest case burden. So they have the most hospitalizations and they have the most cases right now. They also have the lowest rates of vaccination. That's where we're really seeing cases occurring across the country, not just here in Alabama. So it's the unvaccinated group, whatever that would be in a local area. There are lots of reasons why people choose not to get vaccinated. But as those groups cluster together, say it were at the county level or the city level, or say there was a social group that all decided they weren't going to be vaccinated, that's where we start to see large numbers of cases.
Okay, and for those of us who are fully vaccinated, when should we think about booster shots?
It's a great question. We don't have an answer to that yet. The hope is that we won't have to get booster shots. Probably not likely, but one can always hope. My guess is that you'll start seeing recommendations in the fall. That's when we'll have the year data from the Pfizer and Moderna trials. So we'll see how effective the vaccine was at producing antibodies that last all the way through 12 months, 18 months, whatever it is. So by September, October, we should have the scientific data we need to know whether or not booster shots are required. So you've got a little while to wait if you've been vaccinated before you get any news on that front.
Many people who have had COVID are not getting the vaccine because they are already, quote unquote, protected. Why is this not the case?
It's not the case at all, actually. So if you've had COVID, you have no idea what level of immune response your body had to COVID. You don't know whether or not you produced enough antibodies to keep you from being infected again. We're starting to see reinfection in people that have had COVID in the past, so we know it happens. On the other hand, if you get the vaccine, you know exactly what dose you got because they measured it out, they put it in your arm, you know how much of the viral protein you were exposed to. It's not the virus when you get the vaccine, it's just a piece of the virus, just a little tiny protein that can't actually make you sick. When you get the actual viral infection, you just don't know how your how your body responded to it, how those antibodies were created, how many you have left, and whether or not it will protect you in the future. The vaccine is how you can be sure. the infection, it just doesn't provide a guarantee.
Okay, and with Alabama's vaccination rate just under 30%, can you speak more to the risk of the 70% of the population not vaccinated? How much risk is there?
How much risk? That's a great question. So of that 70%, some of them will have a little bit of immunity because they've already been infected. So it's not quite 70%. In terms of risk, it's not the same level of risk that we saw last summer or last fall. It's lower than that, but it's still significant. And risk is one of those things that's very complicated to think about. You still have the same risk of dying. So if you get COVID, the exact same risk of dying that was present in the summer of last year is present today. Same risk of being hospitalized. The thing that's slightly lower risk is that there are fewer cases circulating, so you're less likely to be infected. But again, even though you're less likely to be infected, if you are, you have the same risk of dying and the same risk of being hospitalized. And now we're learning about the complications after COVID. The complications in terms of brain fog, complications in terms of lung function, breathing, heart conditions. So there are so many complications with COVID. If you get infected, your risk is exactly the same as what it was last year.
Okay, and what is your message to parents about getting their kids vaccinated?
It's an individual decision for all parents, and I understand that completely, but it's something that I think is an important thing to do. Childhood vaccinations have been critical for reducing major infections in children. We used to have very high child mortality rates, and although COVID is not one that seems to be particularly dangerous to children, we don't know what the complications will be in the future. We know with the vaccine what happens. We can follow people. We know exactly what the complications may be, and they're very few. We don't know what the complications from infection are. So your child may wind up with long-term consequences in terms of their heart, in terms of their lungs going forward if they have an infection. The vaccine is such, it's just a much safer way for your child to be protected from this virus that is a very serious virus with serious complications. So again, the virus is very dangerous, and we don't know what happens in the future. The vaccine has much fewer side effects, and we know that it can protect us into the future.
Okay, and what would you say to those who are relying on others to get vaccinated to protect themselves?
That's a great question. So I think about it like wearing your seatbelt. Sure, you could get in your car and not wear your seatbelt, and you could say, I'm a good driver. I've got, this under control. I don't need to wear this seatbelt. But you don't know what cars are going to come at you. You don't know what animals are going to jump in front of you. You don't know what tires are going to blow in your car that could lead you to having an accident that the seatbelt would protect you from. The same thing is true of people that are, you're relying on them to be vaccinated. If you're relying on someone else to be vaccinated, that does not protect you in any way, shape, or form. It may keep cases down so that we don't have a high level of cases circulating and a low risk of being infected, but the consequences to you if you are infected are huge.
Okay, and what would you say, I guess, to those who are on the fence about getting the vaccine? If you had a conversation with them one-on-one, what would be something you'd say to them?
The first thing I would say is that the vaccine is very safe, and it's not the virus itself. It does not hijack the DNA in your body. It's just a small, tiny piece of the virus. I explain it to people like a car. A virus is like a car. It runs at your cell, it goes into your cell, and then takes over your cell and makes your body start producing more cars. So now you've got all kinds of cars floating around in your body. And those cars can do damage all over the place in your body and make even more cars. On the other hand, the vaccine is like just a tire. It's just a piece of the car. You get the vaccine and your body is able to make just a teeny tiny piece of the car that can't do any damage because it doesn't have the engine or anything else to do damage to the rest of your body. But it gives your body the chance to fight it and to push back against other cars being formed. So it's really a safe way to go to build up your natural immunity, to not risk being infected. It keeps you out of the hospital. It keeps you from dying. It's a very important way that we have to prevent disease. We've been using vaccines for the past 40 years to keep people from getting things like polio, measles, mumps, rubella, these childhood diseases that used to ravage the population. I also tell people, think about it like this. What if you were drafted, if you're in your 20s or 30s and you were drafted into the military? The first thing they do is say, okay, here are the shots we're going to give you to protect you. This is the same way. These are the shots that you would get just to be protected so that you don't have to go out and run the risk of having an infection. Most people don't realize this, but before World War II and including World War II, more soldiers died of infectious diseases than the complications of war, like violence and trauma. Infectious diseases used to ravage our population, and vaccines are the best way we have to control those infectious diseases so that you don't have to be sick and you can go on your life without having to go on a ventilator, without having to have the rashes and things that might come as complications from this virus. So those are the types of things I talk to people about, that the vaccine is safe, it's been proven effective, very few side effects, but the virus has many side effects.
All right, thank you so much. I think we're gonna go ahead and wrap this up. Thank you, Dr. Judd.
Yeah, thanks everybody for being here.
We just want to let everybody know that we will be having another media Q&A tomorrow with Dr. Kirsten Kennedy. She's Chief of Hospital Medicine. It will be at 11, so be on the lookout for emails with information about that. Once again, thank you, Dr. Judd.